Hi, I'm Dr. Apoorva. I'm a consultant dermatologist and cosmetologist at Apollo First Med Hospital, Kilpauk, Chennai. So there are a lot of skin conditions that are popping up nowadays in people of all ages, and they might be clues as to what is happening inside your body, so they should not be ignored or thought of as insignificant. Ranging from acne, redness on the face, increased hair growth on the face in women, hair growth on the body, skin conditions like psoriasis. They can all point to certain internal disorders like hormonal disorders or metabolic disorders. So we are seeing a lot of acne nowadays because of increasing rates of hormonal disorders in women. PCOS has become so common that in about 10 women, definitely 4 or 5 will have features of PCOS. If not irregular periods, they might have other external features such as resistant stubborn acne, hair growth on the face, hair thinning on the scalp. All of these are features of PCOS that not many people know. But your skin and hair, when it starts changing and not in a good way, it's trying to tell you something that you have to look at your internal health. Even putting on a little bit of weight causes a condition called insulin resistance, and this insulin resistance is seen as dark lines on the back of your neck, and in men it can be seen as darkness on the under eyes or around the temple area. Unfortunately, most people think that it is because they are men or because they go in the sunlight that they get all of this pigmentation. But insulin resistance is the early stage of diabetes, and we are seeing this even in 10 and 15-year-old children, where the parents think that this is dirt because they are not taking bath properly. But imagine if your child is found out to be pre-diabetic at 10 or 12 years of age. I'm sure that is a very scary scenario. But unfortunately, it's happening, but you should be aware of it and look out for these early signs. And if you can bring them for proper workup and treatment, when we identify this early, we will tell you what the treatment and the lifestyle changes that need to be made, and we can treat you. And coming to psoriasis, psoriasis has now been found to be an internal disease. Psoriasis is no longer just a disease of the skin. The same inflammation and redness that is taking place on your skin and producing those patches, the same changes are happening in your organs. They are happening in the blood vessels, in the liver, the kidneys, etc. And unfortunately, people with psoriasis have a reduced lifespan, and they have increased risk of heart attack, stroke, metabolic syndrome, even depression, etc., just because they have psoriasis. So it is best not to ignore anything that might look like psoriasis even at its very early stages. Come to treatment, and there are a lot of options available where we can save you from all of these complications. In the same way, disorders of pigmentation, that is getting black marks on your face or your body, extremely dry skin, any unknown cause of itching, can also point to something hematological, that is, something wrong in your blood work. Very commonly, anemia or nutrient deficiencies are first seen in your skin, and then only we find out by the way of blood test. So if there is anything, it is best not to seek information on the internet or misinformation from other people. It is best to come to a professional so we can guide you the right way.